Before we go ahead and get started, I'd like to introduce our team who is here today. So right now, dialed in, we have Adebayo Alonge, who is the CEO and founder of RxAll, and he'll be joining us during Q&A. We have our CTO, Ankur Kapadia, who will also be joining us during Q&A. And we also are very, very honored to have Dr. Daniel Edereti, who is also a Yale student and has Nigerian market contacts. He used to be a pharmacist in Africa, and just in case we experience technical difficulties with Adebayo, he'll be able to jump right in during Q&A. I myself, my name is Amy Cao. I'm a second-year MBA student, and I'm the CMO of RxAll. And here with me presenting today, very honored to have my colleagues, Anna Huang, who is our Director of Technology, as well as Wei Lu, who is the brain behind all of the science that you'll get to hear about, and he is our Chief Science Officer. So thank you so much. We are ready to get started. All right, so the story of RxAll begins with the personal experience of our CEO and co-founder, Adebayo Alonge, who, from Nigeria, almost died from using counterfeit medication when he was barely a teen. Now, the drugs that he was taking was supposed to cure his malaria, but as his symptoms worsened each and every day, he was eventually rushed to the emergency room, where fortunately, he was afforded another opportunity at life through intensive care. Dr. Daniel Edereti, whom we are so fortunate to have with us here today, had a fever when he was 2 years old. Not knowing what to do, his parents took him to the nearest federal hospital, and not knowingly, he was administered in that hospital counterfeit medication, consequently leading him to lose all sensory feeling in his left leg. Now, Adebayo and Daniel, both of them were afforded another opportunity at life because this was their miracle. However, around the world, not all patients are as fortunate. In Africa alone, over 100,000 Africans die from using counterfeit medication each and every year, and this number is continuously growing as counterfeit drug distributors penetrate the rural African markets. Dr. Daniel Edereti can tell you, he used to be a pharmacist in Nigeria, that there is so much administration work in order to do the authentication of pharmaceuticals across the supply chain. Now, this problem has been tackled from a variety of angles, and many solutions have been brought to the table, such as the use of trusted barcode scanning and these scratch-based phone authentication systems. But as you can imagine, these systems are easily duplicated and have already been defeated by counterfeiters. So the only true way and solution is to truly regulate the supply chain from end to end, from distributor to pharmacy, and that's where RxAll comes in. RxAll is a two-pronged solution, the procurement platform as well as the authentication system. Now, the procurement platform comes to our customers in the form of a user-friendly Amazon-like website where pharmacists can order guaranteed authentic medication at the comforts of their homes and deliver to them at a fraction of their price. The second part of our solution, the authentication platform, utilizes spectrometry. So you can imagine now going to a pharmacy and bringing your drugs and scanning your drugs, and within minutes, or less than a minute, be able to receive a notification on your cell phone telling you whether or not that drug is real or fake. That data is then fed into our authentication system, which utilizes deep learning, machine learning algorithms, and artificial intelligence in order to generate actionable insights to the large playing companies who would be very, very interested in using the data, such as large pharma companies, Pfizer and Merck, hospital retail distributors, as well as regulators. We started our company in Africa because that is where counterfeit medication is truly a problem. In the open drug markets alone, over $600 million worth of drugs are procured on an annual basis. We've started and piloted in Nigeria and Kenya because that's where we have local knowledge, and that's also where we have a large pharmaceutical presence. Now, why are we so excited about our idea at this particular point in time? Because right now, more than ever, there are Africans using internet on a daily basis, and each of them had access to a smartphone. And we truly believe that this increase in technology adoption will truly be a key enabler to our technology solution. And to talk more about our solution, I'm now going to turn it over to our Director of Technology, Anna.
So this is what our current digital marketplace platform looks right now. We require pharmacies, manufacturers, and distributors to upload their pharmacy's license so we can verify both sides of the transaction. And since launching our platform, RxAll.com, in October 2016, we are very proud to announce that we have served over 100 pharmacies and 200 patients. For our second part of our solution, the Authentication Platform, this platform is based on a machine learning matching algorithm. And this is a really important solution to have just because this will allow consumers to truly verify or not the drugs that they have are real. And now we actually have filed a patent in China and I'm currently working with the OCR to file a patent in the USA. And now I can hand it back to our scientist, Wei, who's the brilliant mind behind this authentication platform, and he can explain how it actually works.
Thank you, Anna. Now I'll provide a brief introduction to the scientific foundation of our solution. So our authentication platform is based on a technology called spectroscopy. It turns out beside the visible range that our naked eye can see, there are so many other wavelengths radiation in the nature, which specifically the infrared radiation we can use to take picture of the molecules, the vibration, the motion, the structure. We can record the fingerprint, molecular fingerprint as spectrum. That's the foundation how we can tell which one is counterfeit, which one is authentic. So spectroscopy has been widely used in the industrial setting here in the US, for example, the agriculture, product quality control, pharmaceutical quality control, and even wire fermentation quality control. The problem about using it, trying to apply it to African market is the cost of the spectrometer is really high. So like StellarNet and Ocean Optic, the major supplier in the US, they serve those kind of near IR spectrometer cost at 20K level. By utilizing the dynamic light processing technology from Texas Instruments, instead of using a linear in gallium arsenide array, we can use a single unit in gallium arsenide detector to cut the cost from 20K to a few hundred, which make it possible to use it in African market. So this is a flowchart how our authentication platform works. Now Amy will help me to do a live demo to show how it works.
Okay, so right now we have pills. This is actually anti-malarial pills. It's the most prevalent, most counterfeited drug in Africa. And as a patient now, you just purchased these pills. So how do you know whether or not these pills are fake or real? So we're going to have Jay, would you do the honor of helping us test A5? And Wei is going to walk us through the demo of what you will see on your cell phone. So how that works is you take the pill.
Hold up what you've got there so we know.
Sure. It's a scanner, essentially. Okay, and we're going to have now, Jay, you can go ahead and place the pill right here on the scanner. So
A5?
Yes, A5.
Okay.
It's
now
all
we
ready
do the scan.
Yep.
You can see it's
yep.
working.
This is what you'll see on your cell phone.
Okay, now that's the data from this specific drug. And I can now send the data to my server that run the machine learning algorithm. It will come back the response in counterfeit.
Okay, so you don't want to eat this one. All right, so now we'll have Rob do us the honor of testing now A11.
Okay.
Okay.
Just in a sec.
We'll leave it here for you.
Okay, now
A11.
11. Let's do the scan right now. Okay, now let's do this. Wait for it, because the server is on my old desktop. You can understand that.
Here.
It's authentic.
It's authentic. Yay.
That shows it's working. Thank you.
Wonderful. Thank you so much. All right, so now that we've learned about the technology behind, or the science behind the technology of our platform, we'd like to now take a look at the market opportunity. So the spectrometry market for drug authentication is $800 million, and it's growing on an annual basis. From a competitive landscape, we are the only company in Africa that is utilizing this unique technology to authenticate drugs, and we are bringing it to African pharmacies at an affordable price point. We intend to earn revenue from both the procurement and authentication platform. We intend to earn commissions as well as shipping fees to pharmacies. We will also, from an authentication platform, charge a subscription fee as well as license fee for the large paying customers to utilize our AI platform. Here is our 5-year financial projections. We just finished our Q1 results. We are still in year 0 just as a procurement platform, and year 1 onwards we're going to phase in our technology and start to really keep the financial momentum going, and we intend to be profitable in the next 5 years. From a social perspective, since our launch in October, so 3 months until Q1, we have served over 250 patients. We have delivered over 300 medicines to our customers, and we're operational in 5 cities. We are incredibly blessed to have amazing partnership and support from Yale University and large pharma companies, most recently our Merck Accelerator program, which we just launched in Kenya. We also have ongoing collaborations with the Nigerian Ministry of Health, and with the help of the Thorne Prize, we intend to expand our impact and our market reach. We hope to open up offices in Nairobi, Kenya, as well as Lagos, Nigeria, and continue to grow our commercial development platform. This is our team. We are all fiercely committed to alleviating the problem of counterfeit medication. We are all proud Yaleys, and so we want to bring it back to Yale's original model, which is light and truth. And we truly believe that our solution uses light to determine the truth and provide it to those who need it the most. So with that, that is our story, and we thank you so much for listening. Thank you so much.